Well, thank you very much for staying. We are discussing all things health. Very important and very interesting. We just got to know that there is a malaria vaccine soon to be on the market. Hallelujah, and thank God for that. But just before the break, I wanted to find out from Doc that the health bit, you've done your part. You've come up with the vaccine. But then the developmental side are still doing open drains and leaving refuse outside, breeding mosquitoes. On the light side, I say, well, are you trying to annoy the mosquito? Give them work for nothing. But, that's the dichotomy.
Yeah. I think, just like I mentioned earlier, our Public Health Act, we need a legislation instrument so that some of these issues can be prevented. We can't continue to be constructing and leaving the gutters just like that. We're supposed to seal it. It's one of the easiest way of breeding mosquitoes. I'm aware of the contribution of the Global Fund for HIV, malaria, and TB, their contribution to Ghana that is making a headway in malaria control and prevention in the country. I'm also aware of the Ghana Health Service partner with some civil society organization in doing malaria education and advocacy in the country. All these have contributed to the success with CHOC this year that they announced. But on a more serious note, we need to, we don't have to be over complacent. We need to rather intensify resource financing for malaria education and the production of the vaccine. The reason why I'm saying that is that when you are able to fight a public health issue to a stagnation, it means you have to put in more effort to bring it down. Otherwise, when it escalates, it's more serious. Okay. It's difficult to manage. So we need to begin, the Minister of Works and Housing, the Minister for the Zongo Development. In fact, there are various interministerial bodies that really need to support Ghana Health Service to clamp down unnecessary environment that we create to breed mosquito in the country. When you go to the markets belong to the various district assemblies. But within the market, you see all the drains there, all the gutters there, uncovered and unkempt, and which means that we are breeding mosquito there. So as long as we are fighting to reduce the burden of malaria, we are breeding mosquito to bite us again. So that will be a useless fight. The second aspect of it is that civil society play a critical role. But to be honest with you, if you see the budget for malaria education in Ghana, it's very small, very, very small. And we need to increase the budget. I know the Global Fund is supporting Ghana in that regard, but we need to have a country-grown resource mobilization strategy to be able to take on board the private sector to support malaria prevention in this country, using the public-private partnership policy that we have in Ghana. The third issue we need to do is to begin to work with the traditional authorities. And I'm happy about your leadership and the way you bring sanity in your community. Can we begin to see how traditional authorities have used bylaws to calm down unnecessary social vices in their communities? If we begin to encourage that and partner with them, Ghana Health Service need to partner with them. The chiefs and Queen Mother need to understand the government policies on health, public health, so that they can use their platform to support the education and advocacy on malaria program in Ghana. We are not seeing that much. Let me give you a typical example. The Na of Laura traditional area, that's the paramount chief of the Laura traditional area, who is the president of the traditional council and also a member of the National House of Chiefs. A year ago, identified that his district, Laura district, was performing low on immunization. So we were not getting children to vaccinate. We were not getting children to give them food supplement. So he took up a responsibility and called all his 17 sub-chiefs together with the Queen Mothers and the assembly member and told them that if he hears that their community is having problem on immunization, he will summon the person to the palace and he will sanction the person. After 15 months, the Laura district is not the least performing again. It has jumped totally to a level that is appreciating. The Ghana Health Service have praised him for their contribution. They have praised the coalition of NGOs in health for selecting 2 NGOs to work at the district with the chief and the people there. So that is the contribution of the traditional authority. Yeah. Education, protecting the community ideals, and supporting development. They are best fit. In fact, if you do sample survey, you will get to know that the chiefs still have the respect better than the politician. So what it does means to us as Ghana Beyond 8, we need to strengthen our chieftaincy institution, National House of Chiefs, Regional House of Chiefs, the District House of Chiefs, to be able to play a pivotal role on public health. And if we do that, we will minimize malaria records in the country. And as the case goes down, Ghana stands tall in contributing economically. Because when I'm not sick and every day I go to work, I increase my daily wage, I pay tax. It has other effects. More employment are created so that government get more revenue to do more infrastructure projects.
Since we are talking about chiefs, then we're talking about rural areas, and then we have to look at equity, because the whole Ghana is becoming Accra and part of Kumasi. The whole Ghana is becoming Accra, part of Kumasi. If you're looking for lawyers, doctors, dentists, obstetricians, Accra, Kumasi. What happens to the other areas?
It's very unfortunate for Ghana after 61 years. We still have not prioritized the real needs, the public health needs of the people. We still have not proactively taken decision to serve the larger population in this country. We still have not been able to send the workforce needed to address the challenging health needs of women and children in this country. We still have not been able to respond to teenage pregnancies in this country, because all these things are the negligence or the poor or the apathy on our political leadership. I'm saying so because every politician would want to be successful. But the normal politicians will not want to change certain laws when it is about the masses. They rush quickly to change laws to favor and protect themselves, but they seldomly be proactive in initiating laws that are for the masses. And let me give you a typical example. The Public Health Act, as I keep on mentioning, the Mental Health Act, as I keep on mentioning, are supposed to give more impetus to responding to equity at the rural area, at the last person. If you look at the current services that we are offering, we have over 70% of our doctors in Kumasi and Accra. Wow. Government have announced severally over the last 1.5 years, almost 1.5 years now, that they are taking steps to ensure that they deploy doctors. But it's still on paper. It's still on talks. We have not been able to move from just the political announcement to real implementation of these policy statements that we issue. And I think we are taking this opportunity to draw the president's attention, and more especially the vice president who has been a crusade on this, that please let the people feel the political statement that you make, because the person in the rural area will want to have a specialist when they have health issues. They want to see a public health nurse to be able to help them reduce the rate of going to the hospital. They really don't need to go to hospital. The CHIPS compound or the CHIP policy is supposed to create universal access to health. So it is a good thing. It's a good concept. It's been practiced over 20 years. What we need to do is to resource the CHIP compound, which is the lowest primary healthcare facility. That will educate people. That will stop a lot of cases from going to the district hospital. And the district hospital is only to treat certain ailments at another level. And if they are unable to do, then they refer to the regional hospital. But in this country, you go to the regional hospital, you see malaria cases are treated there. Because their facilities are not there. Because the human resource, the doctor is not there. The public health nurse is not there. The midwife is not there. So we have deficiency in the doctor-patient ratio, very serious. It's 1:7,000, which is very unacceptable. In fact, Ghana really needs over 40,000 doctors as we speak now.
For equity?
For equity.
Wow.
To ensure that every district will have 2 or 3 doctors.
And how much do we have now? Or how many do we have
Currently,
now?
what we have less than, from my records, we have less than 5,000.
And we need 42.
Yes. Wow. And we have the private ones. So those who are private, we don't count them because the government is responsible for deploying. And we keep on hearing the plans of the ministry, the plans of the Ghana Health Service to deploy. We are still waiting to see. But it is high time we deployed doctors. Now, the other issue is doctors are also complaining that even when they are accepting to go to the rural area to serve, they need to have the same facility or comparatively good facilities for their family, for education, and for protection. I mean, housing.
Yeah.
So you don't expect a doctor to stay in a community, in a rented house. That cannot be. It obviously has to be a bungalow, so that he is motivated, he has his privacy, he can even do online education. He should have access to internet, he should have electricity. So we have mirage of issues.
Is it too much to ask?
It's not too much. It is just a political will. And I'm challenging this government that they have talked so much over this doctor-patient ratio. They have talked so much about the midwife-patient ratio. They have talked so much about nurse, community health nurse, public health citizen ratio. They have talked so much about mental health. We are still not seeing the actions. And it is high time we get the legislative instrument on mental health, we get the legislative instrument on the Public Health Act, so that we can demand the Minister of Finance to finance these laws for their implementation. As it is now, you can't hold the Minister of Finance responsible. They will never put it in the budget because they don't have the LI instructing them to do it. But if we have, then it means we could be able to draw the Minister of Finance attention that you have an obligation to make arrangement to finance mental health, because there's a mental health fund. You have the responsibility to allocate funds for public health education because there's public health fund. And even that, the private sector will be willing to contribute because the law will enjoin both public and private sector to bring money to the basket for us to finance our public health systems. And so we do have a lot of challenges in the health sector. We are not addressing the public health issues very well, more especially on the preventive strategies. Nana, you and I don't really need to take any medicine.
No.
The best medicine for you and I is water and fruits. How many of our people know that fruits and water is very healthier than even medicine? We have been consistent to believe that get sick and take medicine. But we have not been consistent to ensure that we are supposed to live in a healthy lifestyle that will have so much effect on our national growth. We have not been taught that. And the public health, the health promotion unit of the Ghana Health Service is supposed to be equipped with equipment, motor vehicles, audiovisual aid, collaboration with other agencies, helping them to do research and able to use the research. For example, the health promotion is supposed to partner with research institutions to know the public perception about public health. They are also to know the trend of people's behavior in the country so that they can prepare strategies to overcome. And they are also supposed to learn from the best practices. For example, herbal medicine. Countries have used herbal medicine to be wealthier. In this country, we still have not placed premium on herbal medicine. But it is known scientifically that it's much more effective, it's low in chemical than any other medicine or drug. But as a country, we are not investing in herbal medicine. We are not investing in the research. We have done something with the Kwame Nkrumah University of Science and Technology and Noguchi. We have done few with the research institution, but we are not investing in them. For example, if you go to, I don't want to be promoting countries, but let me give one example. If you go to Germany, they finance some of those things. The private sector is even willing to give money to government to research so that they can develop their herbal medicine industry. And the cost of it will be much cheaper because you have all the plants here. And let me say this, in Ghana, all the different 1 or 2 minerals you find in other countries, in Ghana you find all minerals or natural resource minerals in Ghana. From water, land, the environment, forest, we have everything in Ghana. Anything you can think of, any mineral or any resource you can think of globally, when you come to Ghana, everything is here. But we have not been able to take advantage to develop ourselves with this natural gift that God has given us and has located Ghana strategically for us.
So what do you think about the drones, introduction of drones to reach rural areas? I don't know if they'll write Antimansa, this is your blood tonic, and then it drops and you have to take it to the chief's palace and the chief says, Antimansa, your medicine has been dropped. How do you even know Antimansa needs the drug? What's the whole drone thing about?
Thank you. I think the announcement by the Vice President and government, for that matter, to use drones to complement the effort in addressing equity is laudable. There's no doubt about it. In fact, the coalition have talked about using technology to serve people much better severally. And so this is something we can give plus to government for this bold initiative. We are, however, drawing government attention to look at how Senegal have used the drone system. What has been the lessons learned from Senegal? Rwanda have also used the drone system. What are the lessons that government can learn from it so that we don't become just announcing that we want to use the drone system, but to learn from that and be able to do it better. It is good because, one, we have challenges in this country, the whole country. We have deficiency in getting blood to save life. So drones can be one of the best options. I read from the WHO website, countries that have used it and are able to reduce a lot of maternal mortality rates. When people are giving birth, they can bleed to death because we have bad rules. So before you can bring blood from one hospital to supplement the effort of the other hospital, the person would have gone. So drones can be the best to increase our national blood distribution system.
So just making sure that
Yes,
all the other
easily within some few minutes they are there, they can dispatch, and because it's a technology, communication is much more enhanced to ensure effective delivery. So we support that. It's also good for childhood immunization diseases prevention, because in the Afram Plains, in the northern part of Ghana, even in the southern part of Ghana, you talk about the western and the central regions, the hard to reach areas where you don't have access to transport, but we have cheap compounds, we have health facilities, and they need to vaccinate children. They need to keep the vaccine in a recommended temperature. So when you go and you don't get a car to come, the vaccine can spoil. So the best option is to use the drone system to transport to the site. After they finish, the drones will bring it back to the safest place for safety keep, for redistribution. So one, it will increase our EPI coverage because Ghana is around 90, a bit above 90%, which means we are doing very well. We are only missing some few children, or we are unable to raise some few children. So if you use the drone system, it can complement. The other benefit of the drone system is that it will be supporting a tax shift policy. Tax shift policy means that community health nurses can be trained to provide more services than just providing education. So it means Ghana Health will have to retrain all the health force in the country to be responsive in using the drone system. Of course, there will be specialized people trained initially, but at the long run, they have to train more health workers to be able to, especially those in the hinterlands, to be able to do. So we allowed the idea, we perfectly support it, we have advocated for it, and we will support government to implement it.
Well, on the subject of support, let's go to University of Ghana's special clinic or hospital. There's two schools of thoughts. One says, look, it's fit for purpose, ready to use. The other says, no, it's not fit for purpose and not ready to use. And they sat there. But meanwhile, it's a facility that could have, really helped somebody. I don't know the NGO's position on this hospital.
Yeah, thank you. The coalition of NGO in health position, together with other submissions made by civil society, is that the facility must be put to use, period.
Now. But
I'm challenging every health professional who think that that facility is not ready to be used. And let's have a debate. Let's be on site there and let's evaluate. Let's bring it even international audit team on health system strengthening. Let's audit and let's get the report to see whether the facility cannot be used. We see, we are hypocrites in this country. And I want to be very frank to this issue. It is not personal, it is objective analysis of the situation. That facility was commissioned by the previous government. It was ready for use. Are you telling me that the Director General then, the Minister of Health then, the Chief Director then, the project financiers then, the University of Ghana that trains medical officers, that is the premier university in this country, that's the lead trainer of medical team. All the professors who train all the people who are talking now that is not ready to be used, they are wiser than or knowledgeable, or they are from a different space, or they are using different assessment to say that the facility cannot be used. It's politically motivated. We want to be very frank on this. It is politically motivated, and we will not encourage this to happen.
I see.
We are calling on the president, whatever decision they are taking, we are calling on the president to say that, please, let the facility be put to use. Let's identify the faults, the problems there, and let's begin. You can never have a perfect hospital.
Okay.
There's nowhere in the world that you can have a perfect hospital. Every health facility is upgraded as and when the demand increases, more services are being required, and more services are added to respond to the needs of the people. And that facility was made specifically for specialized services. It was a well thought program. If there's a political changeover, we don't want to talk politics. We don't belong to any of them. But our position is that that facility is ready for use, and it must be used.
Let's look at innovations. Since we are talking about the specialist hospital, probably this is one of the innovations. What are we being slow to adopt with regards to health innovations?
What we are slow to adopt is digitizing the health system, making the whole system be one, like a mirror.
Let me take a break here because I think this is deep, so I can get a good input on this. So we're coming straight back to find out what we are being slow to adopt in the health system, innovation-wise. Don't go. I want to find out, going to the end of this beautiful conversation, as a nation, what's one critical innovation that we are being slow to adopt?
Yeah, one innovation that we are not able to take advantage very well, and we are very slow in changing to the times, is digitization of the health system.
Okay.
Now, practically and innovatively, if you move from Kolebu to Kumasi for a health service, the technology should be able to display your history to Konfanoche. And if you move to Wa Government Hospital, Regional Hospital, technology should be able to display your initial information from Kolebu in Wa. We have not taken advantage of that. That is one. Two, technology education in the health sector, e-health, e-education in the health sector. We are made to believe that it's only paperwork, face-to-face education that does the trick. No, we have moved, the world have changed. We need to use audiovisual aid, we need to use manuals, online education, so that the doctor that is in Bumpurugu Yoyo can still be there and learn what is at Kolebu. He can still be there and learn how operation is done in Kolebu. We have been very slow. We are not able to do it, but it's done elsewhere. Three, we have not been able to respond to the needs of the people very well because we are not using technology. And thank God that government has initiated this GPR system, the Ghana Post system. My worry has been spotted projects. When we are supposed to have one platform, once you are a Ghanaian, we should be made to be aware that one platform has your records. For example, I was in the US. I lost my passport. In the United States of America, they were able to trace where my passport was. From Ghana to Nairobi to Amsterdam to Florida. They were able to trace. And they were able to know all the transit I've made. I spent 2 days here for business discussion. I spent 1 week here for business discussion. They were able to do that until they got to and they printed the history for me. That technology we must be able to use. So there's no excuse of not using digitization in the health sector. And that would be the best and most effective, efficient way of serving the people better. Anywhere. All the health facilities, we should have internet facility for all the health professionals to have access to internet connectivity, electronic education, and electricity. We must do that.
Finally, what's the way forward, or what's new for the coalition of NGOs in health?
Thank you. The Coalition of NGOs in Health is an umbrella organization over 355 NGOs in 201 districts out of the 216, or now 255. So it means we are nationally well represented. We are much more present. In fact, when there's an issue now, I can get more than 50 text messages, an average of 5 minutes. I can get more than 50 text messages about what is happening across the country.
Wow.
So we are a force to reckon with.
Yeah.
No civil society in the health sector does it like the way we do our things. We best understand the health system in the country. We are a great partner to Ministry of Health, Ghana Health Service. We will continue to partner with the Ministry of Health, Ghana Health Service to complement the role in ensuring that Ghana achieves the universal health coverage in this country.
Doc, thank you very much.
Thank you too.
Very insightful, very interesting. We should have more of this. I want to say thank you again to Labadi Beach Hotel, the Lagoon Bar, served us nice cocktails on the house. We say thank you. And I always give you this number before I go. Tanti's Fashion, they make my shirts. 024-366-2001. 024-366-2001. Until next time, we'll come back to do this all over again. But thank you for watching, and Doc, thank you so much for your time once again.
Thank you.